As the world continues to search for a vaccine, COVID-19 cases around the world is still on the rise. Global confirmed cases now stand at 38.5 million, while death rate still surpasses the 1 million mark. Meanwhile, the number of those recovered from the respiratory disease stands at more than 26 million. The United States still has the highest number of infections with about 7.9 million. India follows with 7.3 million. Brazil is next with 5.2 million, followed closely by Russia at 1.3 million cases, while Argentina joins the list of top 5 countries with about 931,000 cases. Back home, Nigeria's Center for Disease Control has confirmed 179 new cases, bringing the new tally to 60,834. The death toll stays at 1,116, while about 137 patients have been discharged across the country in the last 24 hours, rising to about 52,143 recoveries. This is COVID-19 Myths and Facts. Welcome on board. Now, here are a few facts about COVID-19, which is according to the World Health Organization. Vitamin and mineral supplements can't cure COVID-19. Micronutrients such as vitamins D and C and zinc are critical for the well-functioning immune system and play a vital role in promoting health and nutritional well-being. There is currently no guidance on the use of micronutrient supplements as a treatment of COVID-19. The studies show hydroxychloroquine doesn't have clinical benefits in treating COVID-19. Current data shows that this drug doesn't reduce deaths among hospitalized COVID-19 patients or help people with moderate disease. The use of hydroxychloroquine and chloroquine is accepted as generally safe for patients with malaria and autoimmune diseases, but its use, when not indicated and without medical supervision, can cause serious side effects and should be avoided. And people shouldn't wear masks when exercising because masks may reduce the ability to breathe comfortably. Sweat can make the mask become more wet quickly, which makes it difficult to breathe and promotes the growth of microorganisms. The important preventive measure during exercise is to maintain physical distance of at least 1 meter from others. And the likelihood of COVID-19 being spread on shoes and infecting individuals is very low. As a precautionary measure, particularly in homes where infants and small children crawl or play on floors, consider leaving your shoes at the entrance of your home. And this will help prevent contact with any dirt or waste that could be carried out on the soles of shoes. And the prolonged use of medical masks can be uncomfortable, but it doesn't lead to CO2 intoxication or oxygen deficiency. While wearing a medical mask, make sure it fits properly and that it is tight enough to allow you to breathe normally. Don't reuse a disposable mask and always change it as soon as it gets damp. And most people who get COVID-19 have mild or moderate symptoms and can recover with supportive care. But if you have a cough, fever and difficulty breathing, seek medical attention early. Now, millions of people across England will be banned from meeting friends and family inside their household from Saturday. It means more than half of England's population will be living under high or very high alert restrictions. The government had unveiled a 3-tier system of restrictions for England on Monday to try and stop COVID-19 from spreading. On their Tier 2 high alert measures in London, Essex and York, there is a ban on households mixing indoors, including in pubs and restaurants. So what do we know about these restrictions? Well, areas with the lowest areas of infection in Tier 1, they will face the basic national rules, which include pubs, bars and restaurants closing at 10 p.m. And the rule of 6 will apply both indoors and outdoors. However, areas in Tier 2 face an extra level of restrictions. There will be no mixing between different households in any indoor setting, and the rule of 6 only continues outdoors. And the highest level of restrictions are in Tier 3, where pubs and bars are closed, except where 7 substantial meals. Households cannot mix in any circumstances, and gyms, leisure centers, betting shops and casinos must also be closed. But shops, schools and universities will remain open. Meanwhile, the mayor of London, Sadiq Khan, believes the new restrictions are important in order to protect the lives of citizens. Well, joining me live for an assessment of this issue and other areas of concern is a public health professional and ENT surgeon, University of Abuja, Professor Thighter Ibekwe. Good to have you on the program this evening. So as much as this new restriction, we understand, in London is to stop the spread of the virus, how effective do you think this strategy now will help in keeping the virus at bay, even as against the calls for a nationwide circuit breaker, which is attempted to be a short lockdown, limited lockdown?
Yeah, thank you very much, Esther. The reality remains that COVID-19, as we are speaking, has no cure. There is no drug or treatment measure or vaccine that has been proven to be efficacious against this disease. So the management is largely preventative, and precautionary measures is the way to go, which is exactly what United Kingdom is applying right now, because there is every indication that they're having a second wave within their climate. And again, they went a step further to map the various cities according to the degree and level of risk assessment. Based on that, you have different level of measures being taken or restrictions, and I think this is also a wake-up call for other countries, especially developing countries, to learn from what is applicable in state A may not necessarily be the same that will be applicable in state B, based on what is on ground. It is largely a disease that every precautionary measures and of course all the protocols that have been mapped out should be obeyed.
Okay, so what are the likely implications? Apologies, Professor, yeah. But what are the likely implications of this new restrictions, and how do you think citizens will be able to cope with this new rule?
Yeah, COVID-19 is a disease of nature and nurture. We keep on reiterating this at all times. There's always consequences when you're trying to, control this disease and protect the citizens. You lock them indoors, and the economic impact will be very obvious. And that's why when you, at the same time, you are mapping out strategy, to contain this disease and mitigate spreading, you should also look at the issue of, people's livelihood to balance it out, which this part of the world we can call palliative. So I am sure that as they are doing this, they are already putting in place palliative measures, because of course it's going to tell on their economic impact. It's going to affect the psyche of, the entire populace within the country, who hitherto has thought that it was almost over, having a sigh of relief, only to be informed again that a second wave is on the way. And a lot of time, if good care and good measure is not taken, the second wave can turn out to even be worse than the first one.
So coming back home to Nigeria now, in the line of this concern, what are the chances that we could see a second wave of infections and possibly adopt these mechanisms that is being practiced in London to keep the virus at bay, do you think?
Well, what is left for us Nigerians is to ensure that we abide by the protocols, because as we have said in your programs here severally, it is obvious that mainly what we have here is mild and moderate diseases, unlike in most of the developed countries where you see these extreme diseases. Factors that could be responsible for this we have equally discussed on several occasions, ranging from our demographic data of having mainly young population with very strong immune status, all the way to even cross immunity and possible herd immunity, etc. But we should not take all this for granted. You can see we are gradually reopening. Schools are reopening, their economic lines and borders are being reopened to ensure that livelihood is maintained. But at the same time, we should not take this for granted.
Right.
Physical distancing, use your face mask, cleanse as regularly as possible, wash your hands, and use your hand sanitizers. I don't think that this is too much measure to obey.
Right.
That if and every one of us abide by this, then we'll be able to reduce to the barest minimum the chances of having a second wave in the country.
All right, and that's a fine place to leave it. Thank you very much, Professor Titus Ibekwe, ENT surgeon and public health professional. It's a pleasure to have your thoughts on Myths and Facts tonight.
Thank you for having me. Thank you.
And that's our package on today's edition of COVID-19 Myths and Fact. Thank you for watching. Remember, whatever you do, stay informed and stay safe. Bye for now.